I'm Dr. Anant Kumar Tiwari, Chairman Joint Replacement Center at Sir Ganga Ram Hospital, New Delhi. Today I am going to discuss about the newer technological development that is occurring in orthopedics per se and in joint replacement also. In orthopedics, earlier when this Ilizaro and bone loss frames came, now with the technology and with the help of artificial intelligence, frames are coming in which you can predict the lengthening of the bone, how much to lengthen, how much time it will take to lengthen the bone, how much period will be the rest will be required to consolidate the bone, and all these stuff can be now generated through the computers, and it can be predicted beforehand. The whole this technology, which is very useful for infected and in patients who are having bone loss, is being developed by newer technologies only using artificial intelligence and newer frames like RSV and all. In orthopedics also, with the use of AI, the configuration of the fracture, the 3D three-dimensional pictures of the fracture, whether the nail is a good option, with plate is a good option for fracture fixation, these can be very easily generated AI. The options regarding the treatment can be assessed through computers and artificial intelligence, and a per-operative plan can be ascertained even before going in the operation theatre. In joint replacement, with the advent of robotic surgeries in which the robot plans the size of the implant using AI, artificial intelligence, and the size of the implant, the inclination of the implant, whether the implant, what is the best angles for the patient to be put, and the trimming of the bone, which is done exclusively by robotic arms, so it can be planned beforehand, before the surgical theatre. Now, with the advent of artificial intelligence with augmented reality in joint replacement, surgeon has a choice not to spend his time planning the surgery, because it can be planned at the time of surgery only, and the surgeon wears a 3D camera before his specs. There is a spec in which there is a frame which is showing the exact slopes and angles and how much bone has to be cut in augmented reality, and the surgeon knows the exact amount of bone cut that he is taking, and the degrees and the slope of the implant and the size of the implant. Like in hip replacement surgery, the inclination of the acetabulum during the surgery and after the surgery is finished, the length of the limb, whether the limb is lengthened or it is normal or it is shortened, it can be assessed at during the surgery, and these all data can be validated on the table that the surgeon has put these kind of implants and with these kind of degrees for the patient, for the betterment of the patient, and it is the best possible solution for the patient.